So now, flash forward, you are working to lead Kazakhstan to universal health coverage. And I'm curious if you can talk about specifically how digital health and technology are playing a role in that effort.
Well, thank you very much, especially for reminding me my childhood. Yeah, I remember that time, and that was actually one of the key stories when we were trying to move the next global conference on primary healthcare from Almaty to the new capital of Kazakhstan, to Astana. So we used that trick. I showed that photos of my parents staying there, and I said, we want to have the spirit of Almaty now in the new capital of Kazakhstan, in Astana. So now we have Astana Declaration on Primary Care. So yeah, that was a good story. Thank you. I am very pleased to be here, and of course for your question, it's very critical for us. Because for Kazakhstan, we are in front of the major transformation of our healthcare system. We are launching social health insurance from the January 1st, actually, 2020. So we've been discussing that for a while in our country, why and should we start with social health insurance, which is basically mandatory universal health insurance, and designing for a while, and there were a lot of questions about actually two maybe major questions. Are we ready? And the second was what kind of services we can afford in this new package. So for both of these issues, digitalization was a key issue. So when we talk about what type of services we want to include, what we can afford, actually, we realized that the key issue actually, what type of services we want to be included in the services, what type of services, health services you want to provide and you want to stimulate. And that's about actually managing not diseases, but managing the health. So of course, we were using a lot of patients' data about what are services that people are paying for. So we found out that people are spending a lot of their out-of-pocket money for pharmaceutical agents and for visiting specialists. So using that data was critical to understand what we actually want to afford into packaging, into different packages of health services. And of course, the critical issue was how we can regulate that. So when you see that a lot of people are seeking for, endocrinologists, why is that? Because we found out that a lot of patients with diabetes are not actually registered. So we started to implement systems that will help us to register different critical diseases, non-communicable diseases like diabetes, hypertension, and in 1 year, the number of patients raised by 30% just because we digitalized the system. And the second issue was about are we ready? And that was a big discussion because everyone was talking about digitalization. And in fact, we found out that it's also a very important issue of interoperability, I believe, because in Kazakhstan, any hospitals, they're allowed to buy their own hospital information system, basically. And we have about 50 products on the market, and maybe 10 of them are dominating. So the critical issue was to launch a special project called Interoperability Platform in 2015. So now we have it, and now we are able to solve the main issue that all different systems in all different medical institutions can talk with each other and actually bring that information to the central platform where we can actually give a personal access, and each patients are also involved. So today we know who are our users. Today we know who are our providers based on that digital solution that we implemented.
Thanks so much for kicking us off. I'm really glad to have your perspective to set the stage for this discussion on what it really looks like to design an effective digital strategy. And I hope that we can get to in our conversation how outside partners can support that agenda in countries that are developing these strategies. So I want to go ahead and welcome up our other panelists. First, I'll call to the stage Dr. Stefan Yarman, who's the CEO of the Botnar Foundation, which is a foundation based in Switzerland focused on leveraging technology to improve the lives of children in low and middle income countries with a big focus on health. I see back there Dr. Gitinji Gitahi, who's CEO of AmRef Health Africa and co-chair of the UHC 2030 Steering Committee. Thanks so much for being here. We also have Bic Lee, who is the business leader for ultrasound at Philips. So she can speak to the video you saw at the start of our discussion and how technologies can be a part of these effective digital strategies. And last but not least, Emmanuel Blin, who is the founder and CEO of Tech Care for All, which is focused on accelerating digital health outcomes in Africa and Asia. So a few themes came up in our earlier discussion that I mentioned I'd like to build on in this discussion, including how to prioritize, this interoperability challenge, and data governance. So I would just flag those three themes as themes I hope we can discuss in this panel. And then again, please keep questions in mind for our Q&A. So I'll actually start with Stefan down at the end of our panel there. You and I spoke a little bit this morning, and I learned more about your vision when it comes to digital health and UHC. So your foundation is supporting digital health in a number of ways. In fact, earlier, I sort of previewed this idea that AI can help address the health worker shortage and help deal with pain points in the healthcare system. So I'd love to just hear specifically how you think these advances in technology can help patients benefit and the work you're doing along those lines.
Yeah, thank you so much. And I think we have to acknowledge that what is happening at the moment in terms of AI and data science is what some say is rapidly moving